I'm James O'Brien, and this is the correct way to get up out of a chair. Yes, there is a correct way to get up out of a chair. In doing so, it'll help protect the knees, the hips, and the lower back, and help reduce pain in any of those areas if you're having pain when getting up from a chair. So let's show you how to do it. The first thing you'll need to do is come a little bit to the edge of the chair. This is especially important for us shorter folks. Then you'll bring the feet back slightly. All right, so you don't want your feet way up here because then it's hard to get up out. All right, so bring the feet back slightly. You'll want to make sure that your toes are pointed forward in line with your knees, or that your knees are out wider than your toes. And your feet should be about hip width apart, which makes it easier to bend forward. You'll want to be in good sitting posture with your core engaged. That'll help protect the spine. Next, here's the real important part. You want to get a nice forward lean. By tipping forward like this, what it will do is it will take stress off the back and help you load your buttocks and your hamstrings. From that forward tipped position, you'll then stand upright. Really, you're pulling yourself upright using the buttocks. Here's a great way to practice that. Take your hands in a palm-up fashion and dig them into your hip crease. As you push in hard to your hip crease, like this, that'll encourage you to bend forward through the hip. Once you bend forward enough so you get your nose past your toes, then you'll just squeeze the buttocks and bring yourself upright. When you sit down, you'll do the same thing. You'll drop the chest forward, show off the butt, and then down slowly. So again, here's what it looks like. All right? It's okay if it looks a little bit exaggerated in the beginning. All right? As you get better at this, you'll be able to just quickly go through it. But notice how I'm tipping off. That's the key. Once I've tipped off, then I can stand upright. Now that you've seen the correct way to get up from a chair, let's show you what not to do. And these are really common faulty patterns that I see that result in either knee pain, hip pain, or low back pain. So let's show you what not to do. The first thing you want to avoid is a forward shift of the knees, okay? So if you see here, as I'm standing up, my knees shift forward, and then what I have to do is I have to arch my back to stand upright. So not only is that stressing my knees by shifting them forward, putting a lot of strain there, I'm jamming up my hip here, then I'm arching my back to stand upright. All of that can result in pain in any of those areas. So that's the first thing you want to avoid. And that's really avoided well by getting that nice tip forward. Notice how my knees aren't shifting much forward. Here, hardly coming forward, then I'm pulling myself upright versus this faulty movement pattern. So that's the first thing you want to avoid. The second thing is you want to make sure you maintain correct knee alignment. The number one reason I treat knee pain is where the tibia, right here, the lower portion of the knee, externally rotates. It rotates outward relative to the knee. All right? So whether I'm standing up like this, that's straining my knees, or if I allow my knees to collapse inward and I stand up like this, that's straining my knee. It's twisting it in a bad way. So I always need to make sure that my toes and my knees point in the same direction. Or I can also take my knees out slightly wider than my toes. So if my knees are out a little bit wider, that's okay too. But never do I want to have my knees come in relative to my toes, because that's going to strain my knee in a bad way. When you're standing up, you want to make sure that your knees and your hips work together. You notice how my hip comes into the straight position and my knee comes to the straight position at the same time. What you don't want to do is you don't want to be here, straight in the knees, and then the hips. All right? Really, there should be good synchronization between the knees and the hips. I get into that forward bent position, then I straighten the two together. When bending forward to get up, all that motion should be happening through the hip, like so. All right, I'm getting that nice tip. My chest came down, my bottom came up, but my spine didn't move. It remained straight. A common error is people will round their back forward to try to get their nose past their toes, but then really minimal weight is on the legs, so they can't really use them. So what do? They shift the knees forward and then puff up the chest to stand up by extending their lower back. That's bad. So as you go to sit up, it's important that you get that nice tip forward and the back remains straight. Do not round forward Right here, see all my weight is still on my bottom. I'm not lifting up off the chair. So don't round forward through your back, because if you move your back too much, that's what's going to harm your back. So we tip forward to lift the bottom, squeeze the buttocks, and then stand up straight. Okay, guys, so that is the right way to get up from a chair. It's real important, because you think how many times throughout the day you go to stand up from a chair. Every time you do it, you want to do it the right way. That's going to protect the knees, the hips, and the low back while making your buttocks stronger and making a more stable spine. So good luck, and hope that works out.